itagat ko rajita kwa lenjiritan ko Kas TV ko kama ono lwasa 12 wite site no neke magangalal ngale garan jetinyege ke konyoy setem kimi bota daktari Sunil Kumar Dube enet ko general surgeon cardiovascular and thoracic surgeon en hospital notan wa Medihill kigu yene betuna tan barayni hago bago nyoy setuna tan bo amugul dam anan ngalaga cardiac arrest ki gaski mo ba cardiac arrest kumage tinjutan ak chechang en betabrana so bit get style no bit kiguyen ko nyorchi tarete tan tan makinge no mo bit nyem nyanda na tan mugul dam ge much ko bit ke taret en oret na tan ne. Welcome to Kas TV, Daktari. Good to have you. Maybe you can say hi to our viewers so that we start off.
Thank you so much for calling us over here. Thanks very much.
Okay, absolutely. Maybe you can tell us a little background about yourself.
Yeah, see, I am a cardiovascular and thoracic surgeon. I have joined Medihill group of hospitals over here. I completed my cardiothoracic surgery training in 2006. And for last 16 years I was operating in India, and I was operating all the patients including heart, lung diseases, vascular diseases, that is diseases of the blood vessels, including pediatric as well as adult patients. So I have got an experience of nearly more than 16 years after my training is completed.
Oh, wow.
And now joined Medihill group of hospital just 3 months back.
Oh, wow. Thank you so much, Daktari. Maybe just to start off, when you talk about cardiovascular or cardiac arrest, what is it?
See, cardiovascular diseases, basically they comprise a different spectrum. They're just like our home. We've got different rooms, doors and windows to go open from one side and not open on the other side. There are pipelines to supply water, there are electric supply. So similarly, the heart is having 4 chambers. The blood has to go in unidirectional flow. So there are valves which open in one direction only. There are pipelines which supply blood to the muscles of the heart, which are called coronary arteries, blood vessels. And there is a electric circuit which supplies electricity to the heart, so that heart beats for our whole life. Right. So depending on the problems, the treatment is given. It's like heart, if there is a blockage in the coronary arteries, blood supply to the heart, then it causes some problems, so we have to treat that. If pumping is less because of current is not going, heart is not beating, then patient needs pacemaker. Okay. If there is a structural defect, there is a hole in the heart, we have to repair that. So cardiac disease, which spectrum it is, accordingly it is treated. Heart arrest is the terminal stage where the heart is not pumping anymore. Right? Ischemic heart disease is something which is causing problem in the blood supply to the heart, and because of that we are having chest pain while we are doing some exertion, because the blood supply to the heart muscles there, it is not reaching.
Absolutely. And Daktari, many patients are seen with the heart disease nowadays, and how can one differentiate the problem of acidity, stomach problems, because someone say, oh, maybe I had something with a lot of excess of acid, so someone might think like this could be the issue of acidity, you know.
Yeah. See, when we talk about the to differentiate heart disease from the acidity, usually say because when it is about the heart, the problem occurs, the chest discomfort, burning behind the chest, behind the sternum, it occurs usually when we are doing some exertion. Because with exertion, the heart rate increases and heart is not getting the proper blood supply. So in the diseases of the heart, the problem occurs when the person is exerting, walking, he is climbing stairs, he is emotionally disturbed, he is having stress. That time the chest discomfort, chest pain, it will be more. But it will be relieved when one is taking rest. Okay. But in case of acidity, it will not increase with the exertion. Usually it is the postural thing, or it is associated with the meals. In one type of like acidity, it is aggravated in on the empty stomach, and it is relieved when taking the food. In another type of acidity, there are the different type of ulcer because of acidity. So one is gastric ulcer, one is duodenal. So usually in both the things, it is associated with the meals whether aggravated or relieved by the meals. But in the heart disease, usually it is aggravated by the exertion.
Exertion, yeah. So someone can climb the stairs, up the stairs, work out in a gym. So that will bring the difference between acidity.
Excess of dyspnea or breathlessness is there, more than what usually it used to occur to a person when he was walking the same distance. Is having excess of breathlessness, chest discomfort, chest tightness, the chest discomfort. That is because of heart, and usually it is relieved by the rest or some medicine.
Okay. So what are the symptoms of blockages? Perhaps blockages in the arteries of the heart.
See, chest discomfort, usually it may be in the center of the chest, slightly more on the left side. It may be radiating to the left upper limb, especially on the medial aspect, on this part of the hand. There may be chest discomfort associated with the pain in the neck or the jaw, and some people it may occur on the back also. The pain may be either stabbing type, that somebody is stabbing a knife, or it may be sort of somebody is constricting the chest. Okay. In diabetes, sometimes such patients they do not have the chest pain, but rather they just feel like some burning is there behind their sternum. So these are the usually chest pain is like this, and there may be excess of breathlessness, especially on exertion, which is relieved by rest. So these are the usually symptoms of heart diseases.
So how can it be diagnosed, and perhaps maybe what are the causes?
See, there are two types of causes. Some are non-modifiable factors, and there are some which are modifiable factors. Non-modifiable factors are like one is genetics. If somebody is father, mother, brother, sisters, first degree relatives, they are having heart disease, then chances of person having a heart disease is more. Then gender, male gender is more prone for heart disease, especially female. The males have heart disease 7 to 8 years earlier than the females. But after menopause, the incidence become nearly the same in the males and as well as female. Okay. Then there are modifiable factors which are like person is having dyslipidemia. He is not able to maintain his diets, right? He is not not doing like a proper exercises, sedentary lifestyle, central obesity, tummy is more, hands and the legs they are very thin. The person is smoking, right? So these are all the factors which are modifiable, or lifestyle modification which can be done, and heart disease can be prevented.
Can be prevented. So that is part of the diagnosis.
Yes.
Okay.
So this is actually these are the symptoms. So diagnosis is based on the certain investigations. The important ones are the ECG, that is electrocardiogram. The electric current of the heart is recorded on a paper, and by this, if there are changes, we can find it out the person is having heart disease. If on the resting ECG we are not able to find out, then usually we have to go for some other investigations, just like stress test or treadmill test, which is called TMT. So person walks on the treadmill and the continuous ECG is recorded. If the person is having heart blockages in the heart arteries, usually there are some changes in the ECG which are picked up by us, and then the further investigations may be needed, right? So if there is a stress test or TMT, treadmill test, is positive, then the person should have a echo, that is heart pumping, how much is the pumping, how the heart is functioning, and then ultimately to know whether how much significant is the coronary artery disease, the person needs to undergo coronary angiography.
Absolutely. And maybe as we proceed, as we roll one of the video clip, maybe director can roll as we proceed. There's a term called angiography of the heart. What is that? Because maybe someone have heard it somewhere talking about the and maybe before that, I think that is part of the procedure.
Yes, this appears to be a surgery, heart surgery. So the angiography is just like the heart vessels. They are supplying blood to the heart. They can be seen. We take the patient in the cardiac cath lab, right? and there we give a radio opaque dye to the coronary arteries through a catheter, either from the radial artery, from the hand, or from the femoral artery. The catheter goes to the heart. There we give some radio opaque dye, and the film is recorded. So that will show the blood supply to the coronary arteries, and if there are blockages, they are seen as the constrictions in this video, or what is called angiography.
Angiography. Okay. And you talk about the angioplasty. Okay, we talk about the angiography. What about angioplasty, and how does it help the patients?
Yeah, say if the person is having some blockage in the coronary artery, especially single or double vessel disease where one or two arteries are having blockages, then the person may be benefited by coronary angioplasty. In simple words, if there is a blockage in the coronary artery, we put a spring or stent from inside the coronary artery and we inflate it with the help of balloon. So the blockage which was causing constriction in the coronary artery, it gets opened up from inside with the help of spring or stent. It is called angioplasty. If the angioplasty is not feasible, why? Because there are multiple blockages, one, or they are at the branching side where the angioplasty would be difficult, or it is on the main vessel, which is where it is arising. So left main coronary arteries. Some patients, they have diseases of these vessels, so angioplasty is not feasible. Then such patients are require coronary artery bypass surgery.
If I was coming to that, what is a bypass?
Yes, bypass is just like
surgery.
So in very simple words, if we are talking in the layman language, if a road is having too many hurdles, either because of traffic or the way is not properly working, so what we do is make a flyover bridge.
Yes.
So similarly, in the heart vessels, if there are blockages and the blood supply to the heart muscles is not reaching properly, then we use the blood vessels from the body, either from the chest or from the upper limb or from the lower limb, and then we attach to a big blood vessels in the chest and attach it to the heart vessel beyond the blockages. So we provide the blood supply beyond the blockage. So in short, we bypass the blockages. That is why this surgery is known as coronary artery bypass surgery.
Okay. So in bypass surgery, what is the length of stay in hospital for a patient maybe who has undergone a bypass surgery? See, with the evolution of techniques, so many innovations, our ancestors, they have done good job. They have done so many good things. So with time, we are able to do most of our surgeries on beating heart surgeries. Even at Medihill, we have started, we are doing routinely beating heart bypass surgery. After this, more than 90% of our surgeries are beating heart bypass surgery, off pump. And after this kind of surgery, the patient stays for 2 or 3 days in the ICU and another 2 or 3 days in the ward. So usually 5 to 7 days is the stay of the patient in the hospital after the bypass surgery. Okay, so that is almost 2 weeks or a week?
1 week.
1 week.
1 week after the surgery. Why 2 weeks?
The surgery, We've heard actually about the arterial grafts and venous grafts for bypass surgery. What is better and how do you decide which graft to be used? Is it the intensity, the age, or the kind of the adverse of this disease?
So ideally, as I told you, for the bypass surgery, we use blood vessels from inside the body, so either from the chest. There are 2 vessels on the inside of the chest which can be used. Then there are vessels from the hand, which is called radial artery, and saphenous vein from the leg. Usually, arterial grafts are considered better than the venous graft because long-term patency is more, and the person will have chances of living a better life after arterial graft. It is more. So internal memory artery, if taken from both the sides, and the radial artery, they have got better patency than the saphenous vein. That is why arterial grafts are considered superior. Now, which patient will we will be able to take this graft? It depends on so many factors. When we it is usually decided in the operative period, operative period during the operation. How is the caliber of the vessel? How is the radial artery caliber? How much is the calcification in the radial artery? Right. So, if the person is obese, he is having a diabetes, he is having too much of fat, and his sternum is not stable, not very good quality, then we cannot use the arteries from both the arteries from inside the chest. Then we can use only one of them. So, during the surgery, we also need to tailor as per the patient's requirement and patient's body.
And patient's body, absolutely. So I've had something called heart valve surgery. How does it differ from the bypass?
Yeah. As I told you, as in a room, there are the doors and the windows. They open only in one direction. So similarly, from in the heart, there are 4 chambers. So from the upper chamber, 2 are the upper chambers, 2 are the lower chambers, right? From upper chamber, the blood has to go to the lower chambers. So there are valves which allow unidirectional flow. That is from up to down only, not in the reverse direction. So the valve, they open in one direction and do not allow the blood to go in the reverse direction. So these are called valves. So if there is a problem in these valves, there are 4 chambers in the heart, there are 4 valves in the heart. So if there is a problem, if because of the disease, either these valves have become small and they are not working properly, or there is a leakage, that the valve is not closing properly and it is opening again. So there is reverse blood also. So if it is like that, then such kind of valves, they need repair or replacement. That is, they have to be removed and they have to be replaced with artificial valve.
Absolutely. And I think we've understood now about the heart valve and bypass surgery. What could be the risk associated with the bypass surgery?
Usually, with increasing good technology available, the risk after the bypass surgery or valve surgery is really less. There was a time when these surgeries were not started. Most of these patients, they used to die. In initial part of the surgeries also, the morbidity and mortality was high. But now the actually disease is so controllable and surgeries have become so good that only 2 to 3% risk is there. So 97-98% of our surgeries, they are successful, whether it is a bypass surgery or whether it is a valve surgery.
Absolutely. And you mentioned about the valve disease. Does that mean someone will need to have a valve replacement?
Yes. See, the natural valve in our body is the best. So if we can put the anatomy as far as possible to natural thing, it is good. So if we are able to repair the valve, it is the best for the patient because they work better and they work more. So if we are able to repair the valve, yes, we repair the valve. If the valve is beyond the scope of repair, then we have to replace it. Otherwise, the patient will have a gradual deterioration of their heart function and their future life will not be good. So if the patient's heart valve is so much damaged, then they need a replacement also.
And maybe a little shifting from that, Dr. We've heard about the bypass, we've heard about the valve surgeries. Is it possible, is there a way whereby heart surgery can be done without opening the chest?
Oh yes, yes, definitely. See, as I told you, I was operating in India for last 16 years. But in last 8 to 10 years, we had started doing minimal invasive bypass surgeries also at our place. So such kind of surgeries in which we instead of opening the chest from the front, the conventional surgery, heart surgery, it needs to open the chest from the front to spread it with the help of spreader, and then we can see the heart, and then we can do the surgery. It is the conventional surgery. But in minimal invasive surgery or so-called keyhole surgeries, we do not open the chest from the front. What we do is, if there is a wall surgery, we open the chest from the right side of the chest, a small incision, say about 2.5 to 3 inches incision only, in between the ribs. We open the ribs, and from there we can do the surgery. Or instead of opening the full chest, we just open less than 1/3 or 1/4 of the chest from front. We can do a surgery, wall replacement surgery. If there is a bypass surgery, we can do it from the left side of the chest, and just only 2.5 to 3 inches incision, and without opening the front. So in fact, in Medihill also, when I joined this hospital 3 months back, our first surgery, what we did, it was a minimal invasive heart valve replacement surgery. So instead of opening the full sternum, we have just opened 1/4 of this part, and we have replaced the heart valve of the patient. So we have started all these kind of surgeries in Medihill Hospital, especially in Parkland now, and gradually we are going to expand our things also.
The things also.
Yes.
So that is a minimal invasive kind of treatment.
Yes.
Because you can't open the whole part of, because someone think like you'll open the chest, open the breastbone, that you access. So that is
it is just like abdominal surgeries. Previously they used to open the whole abdomen. Now they are gradually decreasing the size of the incision, as well as they are going through the laparoscopes and everything. So in the heart surgeries also, we are going more and more with the lower, like decreased size of the incision and less invasive techniques, producing this same efficiency. Like, it does not mean that there is some like compromise in the quality. No, the procedure would be the same, but ultimately it will through the minimal access. Efficiency is the same.
So that is the accolade technology.
Yes.
As we roll one of the final clip, as we proceed, what are the symptoms of heart diseases in children? How do you know that this child has a problem? Because a child grows maybe up to 6, 7, 10 years, and then later on you discover, maybe this child has a hole in the heart or something. How can one be able to detect that this child could be having a problem with could be having a heart problem?
See, in children, they may not be able to explain to you what problems do they have, but most of the times it is seen as the increasing breathlessness. When the child is playing, he is running around, this heartbeat will be faster, child will be breathless. There may be increased number of respiratory tract infections or pneumonias, and the child may need admissions again and again in the hospital. Usually when we were also the children, then that time also we used to have some infections, some cough and cold, but that's once or twice in a year or so. But such kind of patients who are having heart diseases, usually the respiratory tract infection frequency is more, so they may need recurrent admissions also. Some of the children, they are having cyanotic heart disease. There is a mixing of pure and impure blood, oxygenated and deoxygenated blood. Such children, they may have some bluish discoloration of their lips, their tongue, their nose, their nail beds, right? So this is called cyanotic congenital heart disease. And the child may be having their body structure which is not up to the age. That is, there is failure to thrive because of all this infection and every problem. The children, they are not able to grow up to their age. So these are all the symptoms which may be because of heart disease. The mother usually comes to us that when I keep the hand on my child's chest, I can feel something rumbling in the chest, or his heart rate is more than the other children. So these are some of the symptoms and the signs which can be seen.
Over the time and over the past years, there have been an issue with the issue of transplant in Kenya. We've had so many people doing fundraisers here and there, trying to fly out to India for transplant. What is the status of heart transplant, perhaps in Kenya right now?
Yes, that's a very important question. I have also I have joined this hospital in Nairobi, Kenya, Medihill Hospital, because of vision of Dr. Mishra, who is the chairman of this hospital. And when he talked to me about this place, he wanted that not only the people of Nairobi they are benefited, but he wants to expand this program so that all over the Kenya the patients can come to the Nairobi. He wants, yes, he wants whole of the Africa to be included in our mission, so that more and more people they are benefited. We don't want to just remain in the national thing only. We want to become an international thing. So all those patients who have to go to other countries outside Africa, they should be treated in Africa only. That is his aim. That is his goal, right? That is his vision. So in heart transplant techniques also, and when I was in India, I used to work in such we were actively involved in heart transplant programs also, harvesting the heart, making a green corridor so that heart reaches to the destination within contemplated time, and then it is again transplanted to a person who needs the heart. So heart transplant thing is very common in so many countries now. In Kenya, I think there is people, they are also getting actively, they started thinking about starting the heart transplant program. Hopefully in the very near future, the government is also going to put up some laws which will help in this transplant programs, not only heart, but liver and other organs also, kidney transplant. It's already in the process. In Medihill, they have done more than 250 transplants in last 2 and 3 years, right? So we are going to start heart transplant program also once there is a green signal from the government and the sufficient laws are passed. We need to have a registered data about the heart failure patients also. So we are going to start heart failure clinics also, so that we can enroll the patients who require the heart transplant. Then there is a need of having an awareness in the people also. If somebody is having a brain death, who is a heart donor, if say I am going somewhere and I meet an accident, there is a excess of damage to my brain, so that I will not be able to have a fruitful life, or it's like my brain is dead, right? So that time my other organs, they can be used by other people, they can remain. So such kind of awareness is needed in the families. Why? Because sometimes the people think that if my child or my friend, my brother, if he is dying, if we donate his organs, he will his body in next the body burial is not complete body, right? So that is not the case. If you can be of help to humanity, one person, if I am dying, I have written my will, and I have written that how many organs are possible, they can be used for other people. So if I die, so my cornea, my skin, my heart, lungs, my liver, my kidneys, and if possible by that time, if other organs are transplantable, then they can be used for other people. So if there is one donor, there can be at least 6 or 7 people who can gain life out of it. So if such kind of awareness is there in people, then there will be so many families, they will be benefited. Not only persons, families will be benefited.
Okay. Thank you so much, Dr. I see time is actually up, and maybe just to wind up, what are the key indicators that someone should be able to, someone has to be aware of, an adult, or if you are a parent, a guardian, what are you supposed to be observing your children, if that may indicate, that may lead that maybe there's a problem with the heart?
Right.
So for adults, we talk about exhaustion, you feel some pain, some congestion,
Yeah. See, if the people they are having a family history of heart disease, then they should be more concerned about their health, and they should go for regular checkups also, especially after the age of 35 or 40 years of age. And if the children they are having excess of symptoms in the childhood also, why not to go for one simple echo, a 2D echocardiography of the heart. That is a very simple technique. It is non-invasive technique. There is no radiation, and they can find it out with the help of 2D echo. At least everything is good, right? Then, if there is a problem in the family, then also, and usually also without a family history also, the person or people they should go for healthy life. See, prevention is always better than cure. We want people happy and healthy. So they should actually take care of their lifestyle. There has to be modification of the lifestyle. They should sleep properly, 7 to 8 hours at least in the night, right? They should eat healthy. The breakfast should be heavy, lunch should be lighter one, and the dinner should be the lightest of all. There should be a difference of at least 2 to 3 hours between the dinner and the sleep, right? They should be able to have a brisk walk or physical activity at least 35 to 40 minutes every day for say about 5 to 6 days at least in a week. If they can do a whole week, it is good, but at least 5 to 6 days in a week, right? They should not smoke. If they are having blood pressure, hypertension, they are having diabetes, they should be controlled. They should not eat junk food.
Junk food, yes.
They should take proper balanced diet. So if the people, and most important, stress, anxiety, it is a very important factor in today's era. Everybody is having stress, anxiety. Stress and anxiety, it causes so many problems in our body, right? From brain to toe. There are so many problems. There may be brain hemorrhage, the heart attacks may be there, right? There may be increased cholesterol deposition, and because of stress and anxiety, the plaques may rupture, and because of that, heart attack even may occur, right? So there are blood pressure may rise, heart rate increases. So stress is a very problematic thing. Person should be able to manage his own stress.
Stress, yeah, absolutely. Thank you so much, Doctor. I think that is the best way to end it. You know, manage your own stress and go for regular checkups. You know, observe the family and check on the trends. Yeah. Thank you so much, Dr. Sunil Kumar Dube, for honoring our invite. We should also, in future, we'll be able to contact you again so that we'll be able to enlighten the people, the Kenyan people, and wish everyone to have a good life. Thank you so much, Dr.
Thank you so much. And on the behalf of MediHeal Hospital, I really thank you people to call us over here and give a chance to interact with you and with the people indirectly through you.
Absolutely.
And we are here for whatever we can do for people. At our hospital, we are offering the services which are at least 30-35% lesser than the other hospitals in the Nairobi or even in Kenya. And we are, our whole team is there to help whosoever is in the need. Our cardiology team is a strong team with a good cardiologist, Dr. Patil. He is doing a good service to the nation. In last 1 year, we have done nearly more than 1,000 procedures in our cath lab and the cardiac surgery things. And our whole team is there to help people as far as possible.
Absolutely. Thank you so much, Dr. Onatanjita kwala jingi tukinita nembe tabrani hegera goba mnyandana tanebo mugulendam da gimita nag Dr. Sunil Kumar Dube enelet ko cardiovascular and thoracic surgeon. Ndaga kasi lebitunat elemeta kanyan guni awa missing ka le stress, manage your stress, anxiety, ya miso gomye balance diet, exercise, you know, agi tigara iger kitunata no la kwengo gitu kinutan en petunata na baraine. Bye bye.